Welcome to We Can Be,
the podcast of the Heinz Endowments,
where we work to build
an exemplary,
sustainable region
where everyone
prospers
and belongs.
Welcome to We Can Be. I'm your host, Chris DeCardy. In the past few months, we've seen significant shifts in our country's environmental health guidelines. There has been a reconsideration of rules for certain chemicals and a pullback of a proposed regulation that would limit PFAS, or forever chemicals, discharged into waterways. And in July 2025, federal orders were issued that provide 2 years of regulatory relief for specific industries, including some chemical manufacturers. My guest today leads a group that helped create the mold for women-centered environmental action organizations and is standing up to the challenges of this new reality. Michelle Naccarati-Chapkis is the Executive Director of Women for a Healthy Environment, founded in Pittsburgh in 2009 with support from the Heinz Endowments. A 2007 Women's Environmental Health Conference organized by Heinz family members and McGee Women's Hospital inspired a group of about 20 women who attended to create Women for a Healthy Environment. Their aim was to address ongoing questions, spur research, and strengthen community organizing for a safer environment for women, children, and their families throughout Southwest Pennsylvania and beyond. In the process, their success has created a framework for other cities around the U.S. too. Michelle has led Women for a Healthy Environment in cementing a significant presence in the Philadelphia region, building data-focused partnerships with Philadelphia Regional Center for Children's Environmental Health and the University of Pennsylvania. She is the personification of the power of positive energy, hard work, and community commitment. I'm honored to speak with her today. Michelle Naccarati-Chapkis, welcome to We Can Be. You have been working to help especially young people in our region live in healthier homes and have educational experiences in and out of school that is healthier. And you've been doing it for a while. What have you seen in that time that has given you the most excitement and most inspiration?
Well, Women for a Healthy Environment is celebrating its 15 years this year. And Women for a Healthy Environment is a nonprofit organization focused on the environmental exposures that impact public health. And we address that through evidence-based science. And our work includes doing community outreach, community programming, and advocacy work. And one of the things that I find really transformative is the amount of education and awareness that has evolved over that more than dozen years. Back in 2009, we were really bringing a lot of new information to communities that they hadn't heard about related to the environmental hazards that we address. And now when we're out there, people have heard. I feel like, our outreach, our education, what's happening at the statewide and national scale in terms of this awareness building of these topics. And so that is something now where people have said, yeah, I know a little bit, or I've heard a little bit, tell me more. And so that's been really an incredible journey to see the transformative change of awareness and education and people wanting to learn more about those areas of focus.
Talk through one of the campaigns that you've led through this period, and what has that education led to, and what gives you hope?
We'll use lead as an example because there are so many stories to tell around that space. In the early days, it was embedded into our programming as one of those environmental exposures that you need to know about and how to reduce your risks around that there are preventative tools and strategies that we can share with individuals. But one of the things we found is that there have been crises that have driven that narrative too. So thinking about where Flint, Michigan was in 2017, thinking about where Pittsburgh was in 2016, 2017. And so those really did spur a lot of action, and that really heightened the awareness.
Since the crisis in Flint, Michigan involving lead in drinking water, it is a question a lot of people would like to have answered here in the Pittsburgh area.
Here in southwestern Pennsylvania, our older towns and cities are at an even greater risk, where the water systems and the housing stock are aging.
There are 425 parts per billion lead content in this water.
Water Authority of Aliquippa shows high lead levels.
Over a 4-year period, the Allegheny County Health Department found that more than 1,700 children in this area were affected by lead poisoning.
We are part of a national lead and copper rule improvements working group that looks at the policy around that space. We created the Lead Safe Allegheny Coalition to work within Allegheny County. We work with healthcare practitioners. We work with county agencies who go into spaces and do renovations and do investigations. It is a broad brush sector where we have people who all can provide some area of expertise to that conversation around lead.
And what has happened with lead in that 15 years? What are the trends for us in this region?
Well, in this region, we've made great strides. When we started, and we were all sitting around a table with the health department and others, at that time, the health department was doing investigations in children's homes who had been tested with an elevated blood level, essentially known as lead poisoning, and the level was at 10 micrograms per deciliter. And so we said, we think that we can do better. And at that point, the CDC had lowered its reference level for children to 5, and now that became the standard. And then in 2023, I believe, the CDC then lowered the lead reference level to 3.5. And we go back and say, let's lower that and let's make sure that you have investigations happening for children at 3.5. So we've really seen this collaborative nature within our agencies really wanting to work together to find long-term solutions and really have that with a lens of what's the primary prevention strategy? How do we get into homes? How do we make sure that we test them before a child gets exposed and has a problem down the road?
And what's your special sauce? If you think about over that 15 years, and what you've honed in each of your efforts, what are you making happen?
So I think the secret sauce is really thinking about that built environment and where people spend their days. People spend 90% of their time indoors, where they live, where they work, and where they learn. And so we really craft educational programming and advocacy around the places where children spend their days. So we've really evolved to protecting that next generation of leaders in our community and making certain that our children have the healthiest place where they can live, learn, and thrive. And so that has evolved into our programs that focus in the healthy home space, in the school space, and then in early learning spaces, daycare, childcare centers. The fabric that weaves all of those programs together is protecting our most vulnerable, which are children.
Talk a little bit about women and women's unique role and leadership. One of the things that is striking is how consistently, when you poll people about their concern about the environment and environmental toxins and exposures, again and again, women are more concerned than men in those polls. What's going on with that, and how did that play a part in the impact you're having?
The emphasis on women was certainly because women have that consumer spending power. And because they're making those decisions for the household, then if we can inform and educate them, then they will change habits. But they're also making healthcare decisions in the home and other decisions. We have a lot of women who are single head of households in communities. And so we want to make sure that they are equipped with all of the information that they need, because we think about things in a low budget, no budget approach too. We want something to be within means and within the accessibility. And as a result, a lot of our efforts are in environmental justice communities, because those are the communities we know that have traditionally been left behind or are under-resourced. And so our outreach to women in those communities is very important.
So one of the things that you've talked about is the direct outreach and the direct action, so people can make decisions in their own lives and in their own homes. And we've been really privileged to support your work in schools and to take direct action to help do assessments in schools around lead, radon, and then to be able to take direct action to address those in that setting. At the same time, to get the type of scale for everybody in a community, you often need to work at a different aperture or a different level. Talk a little bit about how your work has extended or expanded over the years from this very localized direct action at the individual level into the policy world where you've been trying to work with coalitions to make change. And how do they work together in concert to achieve what you're trying to make happen?
It's a really good point. As we talk about when we have workshops and community programming, we'll share the tools and the resources and give folks actual supplies like water pitchers that remove lead from drinking water and microfiber cloths and green cleaning kits and such. But then when you start talking about the why, the broader effort of, but why are we doing this? It really does lend itself to we need more policy protection. We are very fortunate to have the funding of Heinz and the commitment to really launch what we've described as the 1,000 Hours Project as an initiative and an example. So here, there's the funding to both test and mitigate for lead, radon, and poor indoor air quality. In addition to having these schools and childcare centers take advantage of that opportunity, they have the technical assistance that we can provide them, to look at these lab reports that are very detailed, and oftentimes people don't understand how to read the results and such, and so we can develop a plan with them for how to mitigate. That is extremely valuable because we know that, for instance, with lead and radon, you can find it, you can test for it, and you can fix it. And then you've just prevented 2 environmental exposures that we know are directly correlated with long-term health impacts, such as cancer and neurodevelopmental issues. The policy, though, we have a lot of data now that we've collected over the years. So we can use that data and we can go to legislators. And when they say it's too expensive to test, we can say, actually, it's not. And here is all of our data that we can share with you to say, it actually costs $1,500 a building to test. And that's within means. And then in addition to that, certainly we're working on, for instance, a bill right now, and it would require schools to test for radon in their building once every 5 years. And they would have to mitigate if radon is found. And they also are required for a new school building to put in radon-resistant construction. There are 500 school districts across Pennsylvania. So, we can work with so many, and our funding only goes so far. But when you have a policy in place that would require that type of testing, now we know we've been able to affect and reach all 500 school districts.
It's super helpful. I think the 1,000 Hours campaign refers to the fact that young people spend 1,000 hours inside these buildings in educational environments every year. One of the things that you have done is lifted up schools that have been exemplary in addressing all these issues. And I wondered if you could give an example of a school that you've worked with where you've seen multiples of these interventions, where you've given them these awards. And what has that meant for the children and the families inside that school?
I remember the very first school district that was all in, and they really had a parent champion to guide that work, was the Pine Ridgeland School District. And that's when we started our Healthy School Recognition Program. That particular parent had a concern because their child had a lot of immunodeficiencies, and so they were compromised, and they also had allergies. And so that parent wanted to have the healthiest environment for her child during the school day as possible. And so we said, well, we've got a program for you. And so we really sat down with many other parents who were part of the PTA who all came together and said, let's embrace this at that elementary school building. They were such champions that they went through the checklist and essentially did at least 85% of the things on the checklist. And this was a pretty long checklist.
It's on your website. It's great. And it is long. So that's
very
impressive.
Comprehensive. So the fact that they went through this and were able then to institute or implement a lot of the practices really said a lot to their investment. Now, the trick is making sure that that school continues that and it's sustainable when that parent's child then graduates from the 6th grade and goes to the 7th grade and goes to a new building. And so, making sure that you're making it embedded within just the practice of that building, and you've got the administrator and facility director and school nurse all committed to that, to making sure that it doesn't get dropped, so that you have a new set of parents who are coming into that building and all will embrace it as well. And then the other example was thinking about the Clairton School District, where we've been able to be in that building with students during lunchtime and delivering what we call the Eco Steward program. And so it's bringing these environmental health topics really to the students so that they're learning them throughout the day. So the students are literally taking time out of their lunch to hang out with us and learning about new topics. And it's really been impactful. And the students had a learning project afterward. It was up to them to decide what they wanted to do. And so they had 2 projects that they decided they wanted to put into the neighborhood. One was a community garden at the community center, and the other one was a sustainable fashion show. And they were walking the red carpet, and because they really started learning about microplastics and plastics and what type of fibers are best for your clothing, and thinking about waste and thrifting. And so it was really a fun experience for both the students and for our staff.
local environmental group is working with lawmakers and schools in this area to study the health of schools. The group's State of Environmental Health in PA Schools 2025 report covers 13 different categories for public schools K through 12. Topics like lead in drinking water and in paint, age of buildings, mold, radon, and asthma rates. 98 districts in southwestern Pennsylvania took part in the report, spanning 10 counties in the area. For the state of Pennsylvania, it states among districts testing water for lead, almost 95% found lead, but remediation remains rare. 52% of southwestern PA school district tested for mold, but remediation documents exist for only 1 of 26 districts advised to make changes.
You made reference to the importance in the use of data in this mix. Talk a little bit about where you get information from or when you need to generate it. And then how do you utilize that information in a way that helps inspire folks to action when it so often can feel overwhelming to be able to sort through and to know what to do next?
Well, overwhelming by staff and others, I will say. We are on our third iteration of our State of Environmental Health in Pennsylvania Schools report. And through that report, what we do is random samples of collecting data all across the Commonwealth so that when we met with legislators on the Education Committee in Harrisburg, we could say, here is a representative sample across the state. We have data for over 250 school districts now across the Commonwealth. We're halfway there. But what we do is we look at essentially all of the environmental hazards and we ask the schools, what's your approach? What have you done to test, like lead, like radon? We look at the asthma rates of children in school buildings because that's a good indication where there might be a concern. We look at whether or not they have an indoor air quality management plan. What we can do then is use that data to say to the schools, we saw that you're using 300 cleaning products. And I'm not exaggerating. There are schools that have 300 cleaning products in the district that they use. And we'll say, we can save you money and we can save you time and move to a green cleaning program where you're going to need 5 of those products. We have healthy home assessments. So we have community health workers who go into the home and they'll do an environmental checklist to look at the healthy home principles and see where the needs are in that particular household. So if that household is sitting next to a large Title V permitted source, so essentially a source that is emitting pollution, we can leave behind air filters for the various rooms in the house. If it's a home that has been in what was not traditionally a floodplain, but now has moved to being in a floodplain, we've seen so much of that flooding in our region over the last couple of months, we can leave behind dehumidifiers. Pittsburgh really has a lot of wet basements.
That's terrific, hugely helpful in that mix. So you just alluded to the fact that the world around us is not static and is changing. And so I'm interested in talking about this moment a little bit. So one of the things you just said is that we've got increased heavy rains and flooding here. Is that changing your focus and how you think about your work? Or what are some of the things that are happening in our environment, our built environment, or our natural environment around us now that are becoming more of a priority for you than perhaps in the past?
I would say, one of the things that it's become a high priority is just this aging infrastructure. The northeastern part of the country has a lot of aging infrastructure, and there has been a lack of investment and maintenance in those structures over the last 20, 30, 40 years. And so as a result, we're now playing catch up, and we may have some emergency situations that have to be addressed. And so those are a lot of the calls that we get into our organization to say, I have an emergency roof repair. Do you have any funds for that? I've got a leaky window now that has led to an incredibly terrible mold situation in my home. Do you have funds for that? We do right now have a fund. It's through HUD called the Healthy Home Production Grant. So we are able to make investments in the homes, but that's limited funding. And so I think that long term, we really have to be creative in thinking about the funding investment that is needed. And so we're working on that here at the local level to try and identify a long-term funding solution for these emerging housing needs that are so crucial.
What would that look like, or what are you exploring?
This region and every other county in the Commonwealth had the benefit of what we know is the whole home repair program. What we found with that program is there were over 4,000 applicants, and they were only able to fund about 170 homes.
Yeah.
The need is great. So what we're doing is looking at trying to create a large fund that could be invested and sustained and endowed, that the organizations that do this home repair work would be able to access. The goal behind it is that it wouldn't necessarily matter who's in office. It wouldn't matter if a legislator likes the idea or that if there's any money in the state budget for it to actually get passed. So it's something that we want to look at as a region here within our county so that we have something that's longstanding. And so we've been working with colleagues and friends out of Cleveland who created this same model. And they've got a $140 million fund that they've created specifically to address lead hazards in homes. We want to broaden it a bit because we know we have so many other healthy housing needs across Allegheny County.
The potential to find a way to have a source of funding that can actually meet the scale of the need and the opportunity that can help people in their homes have healthier homes and also potentially to reduce their bills in living in their homes. It sounds fantastic in that mix. At the same time, other things are also changing right now. One of the biggest things we've seen in this year is changes in focus at federal funding for public health and environmental issues, grant and loan programs that have ended sometimes overnight. Has that impacted you directly, and is it raising for you longer-term concerns about funding sources and priorities?
It has impacted us directly a bit. There were some grant programs that we were involved with that had been cut through the EPA. Because we have these federal cuts, then that's why we're really leaning into thinking about at the local and state level what can be supported. We have great concern about some of the issues that are happening at the federal level. I had just sent a colleague an email 2 days ago saying, I don't know if you received this notice yet, but the EPA has just eliminated the Office of Science and Research.
Mm-hmm. And talk about the importance of that. So it's one thing to have funding potentially cut, but underneath everything we've been talking about has been science and data and information. When you talked about lead, you said that the assessment of what would be an okay risk for exposure was cut in half and then nearly cut in half again, not arbitrarily, but because of an investment in research to understand those health impacts on young people. So talk about what you see happening around data and science that has traditionally been taken care of at the federal level, and what are the long-term implications for that?
A lot of research happens at the federal level that is very significant. Our work is based on science and evidence-based, peer-reviewed journals where this amazing work is being conducted. And one of the things that I think about, frankly, is PFAS as an example, PFAS, substances that are in a lot of consumer products. And
these are sometimes known as forever chemicals.
Yeah, yes. So they're forever chemicals because they bioaccumulate and we can't dispose of them. So one of the things that the EPA had done last year was they had an amendment to the Safe Drinking Water Act. And it was the first time that had been done in over 25 years. That had what we describe as maximum contaminant levels, MCLs, of PFAS chemicals, and have been linked through science to health impacts. We know it's a carcinogen. That is the science that happens within EPA and at the federal level that is so critical. Out of the gate with the organization, one of the very first things we did was advocacy around toxics and toxic chemicals. And that was the amendment to what was known as the Toxic Substances Control Act, TSCA. We did that for 10 years with partners all across this country. And to see any rollbacks to these amendments that really have been demonstrated that they would protect the lives of millions of individuals across this country is frankly alarming. We have to do better.
Yeah, earlier in my career, I did some work supporting better understanding of the impact of endocrine disrupting chemicals. The advancement in science and human health over time was extraordinary. So much of the testing has always been done at adult males as opposed to with women or with children. And one of the other incredible things was that it wasn't necessarily the load of these chemicals, but it was when they showed up, and sometimes smaller amounts at particular developmental moments could have outsized impact. So the advances in the science to be able to understand at increasingly fine levels about what chemicals are doing to us in our bodies has been extraordinary in the last 30 years. It is perplexing to me that we would want to eliminate that science, especially because having science at that refined level allows you to have better policies that can assure that you're actually getting the greatest bang for your buck, that you actually are eliminating what you should be eliminating where. So I can imagine that this has got to be a really difficult time for you and for the coalitions you're working with. You talked a little bit on the funding side about trying to shift to the state and local level to make up for some of these gaps or to reorganize how to address it. But what do you do at this basic science level?
In Pittsburgh, we're very fortunate for our academic institutions in our own backyard. And so we have the University of Pittsburgh, who has done a lot of work in this space. And Carnegie Mellon has a Green Chemistry Institute. And so, frankly, we've leaned in on the academics at those institutions. You know, what I worry about is the ability for them to continue doing that. So we know that the funding, and I would hope that at least the research happens in that space, because, you know, there have been folks like Dr. Terry Collins at CMU where we've had decades-long conversations and explored that work that he's done. You had talked about endocrine disrupting chemicals, and I think about BPA. And that BPA, now we know the science, and we've invested in that space, and BPA is no longer used. You know, there are alternatives to some of those chemicals, and we have to invest in that green chemistry so that we can advance that work to create healthier communities.
Are there other public health, environmental, citizen organizations that you work with locally, regionally, or nationally that you particularly admire?
The environmental world is full of nonprofit organizations, and we are so fortunate in Western PA to have hundreds of them. And so to narrow them down is a little challenging at times, certainly. You know, what I tend to think about is all of the coalitions of which many of these organizations are a part of and work so collaboratively together. The Breathe Project is certainly an example, but there are some that have been happening at the local level that are so inspirational as well, like VCAN, Valley Clean Air Now, and Allegheny Clean Air Now, that have stepped up to fill the needs of very specific communities in their own backyard. At the national level, people out of Earth Justice and NRDC and others. And then there's a regional approach that goes beyond just Allegheny County and southwestern PA, like we're part of the Great Lakes Lead Elimination Network. And so there's a lot of this coalition building that happens across the country that we're very fortunate to be a part of, and we admire all of the groups that participate.
And then you decide to move into public service directly. Talk a little bit about that decision, and what has your time on Allegheny County Council meant for you, and how does it relate to your day job?
At the local level, I had helped my municipality with their comprehensive plan. I had helped them with their zoning ordinance plan, and so they said, well, you should join the zoning hearing board, and I did that, and so I was chair of that for about a decade. And so that was the extent of my public service experience. You know, at one point there was the seat opening in the eastern suburbs where I was born and raised, and I had people say, you should do this. Thought about it, talked about it with my family at that time. My kiddos were launching their next phase and starting college and such, so I didn't have the volleyball game and soccer games to attend to anymore, and I thought,
So you decided to go to a different volleyball game?
Yeah. I said, I've got some time to give, so let's try this out. But I'm glad that I did, because one of the things that I'm able to bring to that council is the public health focus and conversation, the nonprofit conversations, so that they understand social services and safety nets and what's needed and how these operate amongst community. In addition to that, talking about these environmental issues of concern. And so this has been, I think, both a learning experience for me, but as well as my colleagues, where I can educate them on these various topics. And they've expressed that they've benefited from that too. And now I'm chair of the Housing Advisory Committee, wearing my Women for a Healthy Environment hat. As the chair of that Housing Advisory Committee at the Allegheny County Health Department, that has helped to have conversations with the council members about the housing needs across this region. And so I think that it's been a nice way to extend that conversation both with housing, with air quality, and other issues of concern across Allegheny County.
Has it made you stronger in thinking about the practical aspects of difficult policy decisions and compromise and working across different perspectives? You're now in a role where you've got constituents constituents who disagree on things wanting you to be able to take action. And that, I would imagine, is a little bit different than when you are solidly behind a particular agenda item that you care about at Women for a Healthy Environment. What have you learned from serving in that way that has been useful for you in your engagement with constituency and community?
I think one of the very interesting things is because with Women for a Healthy Environment, we have a policy arm of the organization. We've done that work for so long. I've been on the opposite side of the table, been in D.C. on lobbying days for various issues of concern, as well as at the state level and at the local level, at the Allegheny County Health Department and Council. I was at that podium and had my 3 minutes to be able to deliver my message. And so, to your point, there are some times when constituents won't agree. And what I do lean in on is my research, understanding the issue, digging into it, talking with our staff at council and their great level and depth of expertise, and always having integrity, in the approach and a rational reason why a decision was made in a particular way.
As you look to the next 15 years, what inspires you, what motivates you, and what is that next set of changes that you want to see for our region?
We are at this interesting time frame. I had talked about investment in infrastructure over time, and we know that, our school buildings are on average 25 years older than the national average. And so we've got to really plan ahead. And so as I talk about that with our team, it's essentially not what's happening tomorrow, but what do we look for in the next 5 years and 10 years and 15 years, and how do we put these policies and practices in place so that we're creating strong systems. And there has been so much that science has shown us. Now we've got to really invest in the people. And so I think about it as it relates to Women for a Healthy Environment and growing our organization, thinking about how volunteers, community leaders can help us mobilize and move into different areas. We have been so fortunate to be in the southwestern PA region, but frankly, I think the northwestern PA region and perhaps northeastern could use a little, our support as well with these unique programs that we offer. But one of the things that I think about is a holistic approach to our work. So if we look at a particular neighborhood or municipality even, and we're in there and we're doing our community health assessments and we're working with that school building and we're working with that child care center, we're creating this synergy of a very healthy space. And how do we use that model and replicate it across other neighborhoods is now going to be that next phase of what does Westmoreland and Washington and Beaver and Butler counties look like? Looking at the rural areas that have been under-resourced. And so now we're trying to build out regional approaches to some of that work.
Oh, that's fabulous. It's such an inspiring vision. The name of our podcast is We Can Be, and we like to end each episode with this question. So what do you think we as a community or a country or a world can be?
We can be inspiring. We can be informed. We can be thought leaders. We can open doors and listen. We've done a lot of work with our youth. And one of the things that still sticks with me today is a webinar that we had in February. And we said to those young adults, what do you need from us? And they said, we need you to step aside. We've got this. So our next generation, they put us in good hands.
Ooh, that's fabulous. Thank you for the time. Thanks for being with us. Now I'd like to turn to our resident expert on all things public health and environment, Phil Johnson, who leads this grant-making portfolio for us and has supported Women for a Healthy Environment for many, many years. Michelle talked so compellingly about the importance of their work and the different types of impact that they have had. What is one thing that really stands out for their work and how it's improved children's health in our region over time?
I think it would be persistence and just a continual progress over time, year in and year out, this cumulative movement toward essentially having to look at a physical infrastructure where children spend their time in intimate connection to schools, childcares, homes, which sadly is impregnated with some of the most hazardous neurotoxic compounds ever invented by humans, such as lead. asbestos. Now those very compounds are in the brains of the children, permanently impacting their growth and development into adulthood. So how do we deal with that? Well, there are lots of ways to deal with it, but it requires persistence and time, one building at a time, one child care at a time. If you do enough of those and you build up enough momentum, you get a policy. And that policy can then capture hundreds of buildings at a time, an entire state or an entire country at a time. But until that magical moment happens, ethically, something has to be done year in and year out. Women in a Healthy Environment embraces both of those approaches and has had benefited from one amazing leader for over 10 years. It's really quite a story.
We also have our federal government stepping away from putting stronger policies in place, stepping away from strong regulation that is already in place, and indeed moving away from supporting the basic scientific understanding and reporting of what is happening in our environment. As an experienced grant maker who's been working with nonprofit organizations for years, what is our role to support leaders like Michelle and organizations like Women for a Healthy Environment through this particularly rocky period?
So in order to solve this problem, the first thing that's needed for an organization doing this work that requires a tremendous amount of public engagement and education, and also requires courage to stand up to the status quo in all of its manifestations and use science and use argument and use example to say, not only is this unhealthy for children and adults in these environments, but there are solutions to rapidly fixing what took us generations to create. We can turn this around. We can break this exposure pathway with rather small targeted investments. We can put water filters in water fountains in high schools, in elementary schools, and child cares very quickly, very expeditiously, very affordably, and break that exposure pathway to drinking water in one season. And so the first thing is that a leader like Michelle, a group like Women for a Healthy Environment, they need to have a constant, reliable source of not just resources, but also support in terms of folks willing to stand up with them, alongside with them when the going gets tough, to say what you're doing is right and it works and we're here with you. The second thing is they need to have the vision to see a society where the policies can be changed, the votes can be collected. We're willing to do that hard work to get that policy win. Because once that policy is enacted, and assuming that it can be then implemented and not challenged forever in the legal system, then all of a sudden the magnitude of prevention just jumps up almost logarithmically. And that is just the biggest win ever when that happens.
Yeah, those are two really good examples, from the very specific, like water filters, things you can do right now, to the systemic, which is a policy that gives you the direction to be able to make fundamental changes across essentially all schools, housing, those sorts of pieces. So anything that jumped out for you in that conversation with Michelle? You've worked with her a lot over the years. Was there something that she touched on that particularly struck you in this moment?
The thing that strikes me about Michelle's work and her leadership is that we have to constantly make the case and make the argument that we have to invest in the infrastructure that houses our children. These are often not the most significant arguments that are being made within the fabric of a school society. There are so many needs that educational systems have. And concurrent with that, our society is really not that well versed on the challenges of what it means to have a healthy environment for children. We almost assume that that's the case. How could it not be the case? No parent would ever really just make the assumption that the child is going to a school, being exposed to lead. The school may have to shut down a certain number of days a year because there's no air conditioning. Most parents just would not think that that's what they're signing up for when they live in a city and they're sending their child to a school to get educated. Unfortunately, that is what they're signing up for without knowing it. So one of the hardest parts, I think, of Michelle's work, someone has to communicate this. Someone has to lay this out in a fact-based way, like, look, this is happening. These things should be a priority because otherwise they're going to undermine the ability of the children to learn and grow. They're that fundamental.
Yeah, you talked about at the beginning here, Michelle's persistence for healthy environments, commitment over a number of years. And they've had extraordinary successes, school after school, with radon remediation as an example. And so with all of these headwinds is a really smart organization playing a critical role that we've been pleased to support for a very long time, making a difference and putting this region and our communities in a position for even better things in the future. Thanks for the conversation, Phil. It's been good to talk.
Thank you.